we have this really strange statistical paradox in modern pet ownership right now.
Right. It's a very specific modern problem.
Yeah, exactly. Because, I mean, dogs are living longer, healthier lives than they ever have in human history.
Oh, absolutely. The care is incredible today.
But, and here's the catch, if you spend like 10 minutes doom scrolling the health forums for any large breed, you'd think they were all on the brink of collapse.
It's so true. It could be terrifying for a new owner.
It really is. You bring home this goofy, massive pod Rottweiler puppy, and almost immediately the joy is kind of overshadowed by this mountain of terrifying medical terminology.
Right. You're suddenly reading veterinary journals instead of just playing with your dog.
Exactly. You start reading about dysplasia and bloat and, failing hearts. And suddenly it feels less like you've adopted a best friend and more like you've taken in a biological ticking time bomb.
Yeah, it's an incredibly common anxiety cycle.
I can imagine.
The amount of specialized medical information available to you as an average owner is just staggering now. So when you're just looking at a raw list of potential diseases, it feels like a guarantee of future heartbreak.
Rather than just like a list of possibilities.
Exactly. It's a catalog of possibilities, not a prophecy.
And untangling that anxiety from the actual medical reality is our mission for today's deep dive.
Which is such an important distinction to make.
It really is. So we're looking at large breed canine health, focusing specifically on Rottweilers today.
A fantastic breed, but yes, they have their specific needs.
Right. And our source material today is this really comprehensive audio transcript from the Rottweiler Health Academy.
Which is incredibly detailed.
Super detailed. So we are going to break down these intimidating medical terms and draw a hard line between what is a guaranteed risk and what is simply a predisposition.
Because those are two very different things.
Exactly. The ultimate goal here is to give you the tools to be a proactive, highly informed owner instead of a paranoid one.
Which is much better for both you and the dog.
For sure. Okay, let's unpack this. Where does this fragile reputation come from?
That's the big question, isn't it?
Yeah. Like, are large dogs actually fundamentally unhealthier, or are we just suffering from information overload?
Well, the answer is a fascinating blend of mechanical reality and the simple fact that our medical magnifying glass is it's infinitely stronger than it was even 20 years ago.
The technology has just exploded.
Right. The diagnostic landscape has undergone a total revolution. We aren't just guessing anymore.
Let's talk about that magnifying glass, because the context there is everything.
It really frames the whole discussion.
Right. I mean, think about how people talked about large dogs in the 80s or 90s.
It was a completely different world.
Yeah. When a 9-year-old Rottweiler started having trouble getting up the stairs or, just slept through the afternoon, the diagnosis was usually just, oh, they're getting old.
Exactly. It was just accepted as this unavoidable natural decline.
Right. But today, we don't just accept getting old as a diagnosis.
No, not at all. We take x-rays, we run advanced blood panels, we even do MRIs.
Which is wild to think about for a dog, but it's amazing.
It is. We're actually identifying these specific degenerative changes in their joints or their organs. We're giving a specific Latin name to the thing that used to just be called slowing down.
Right.
And because we're formally diagnosing and documenting these conditions at such a high rate, it creates a bit of a statistical illusion.
Oh, I see.
Yeah, it makes it look like these breeds are suddenly plagued by new illnesses. In reality, our detection methods have simply caught up to what was already happening.
That makes so much sense. But we also have to acknowledge the other half of the equation, right?
Yes, absolutely. Which is entirely grounded in physics and genetics.
Right, because they're just physically built differently.
Precisely. The sheer size, the deep-chested build, and the genetic history of a Rottweiler absolutely create a higher statistical likelihood for certain specific mechanical and internal issues compared to, say, a 10-pound terrier.
Well, I'm glad you brought up the statistical likelihood, because we really need to define the word predisposition.
It's a very loaded word for a lot of people.
It really is. I think when a lot of owners hear breed predisposition, their brain immediately translates that to a definite outcome.
Right. They think it's 100% going to happen.
Yeah, but a predisposition isn't a guarantee.
Not at all. Thousands of large breed dogs go their entire lives without triggering these specific health issues.
Exactly. So it's like a genetic check engine light.
Ooh, I like that.
Right. That light might be a bit more sensitive in a Rottweiler than it is in a mixed breed, but The light turning on doesn't mean the engine is fundamentally broken or that the car is going to explode today.
No, it just means you need to get it checked out.
Right. It just means the sensor is highly attuned to certain systems, and you just need to pay attention.
That's a great way to put it.
Yeah.
And, the source material offers another brilliant way to frame this using a weather analogy.
Oh, right, the weather one. Let's hear it.
So, think of a breed's genetic predisposition as a highly localized weather forecast.
Okay.
If the meteorologist says there's a 70% chance of rain in your area, that doesn't mean you're going to get struck by lightning the second you step outside.
Right. It's not a disaster warning.
Exactly. It just means it's a very logical day to carry an umbrella.
That is so simple, but so effective.
Yeah. And in veterinary terms, carrying that umbrella means knowing what subtle signs to look for and structuring your daily routine to mitigate those specific risks.
Okay, let's apply that logic to the most obvious risk factor for a large breed, their sheer mass.
Because there's a lot of mass there.
Right. If a dog's physical build increases their statistical risks, the first place we should look is the physical framework carrying all that weight around all day.
The skeleton, the joints.
Exactly. We're talking about the joints, and specifically hip and elbow dysplasia.
Which are huge topics in large breed circles.
They really are, and these are developmental conditions, right? Not something they catch like a cold.
Right, they're entirely developmental. The word dysplasia simply refers to an abnormal growth or development of a tissue or organ.
Okay.
To understand why it's so problematic, you have to look at the mechanics of a healthy joint first.
Let's do that.
Take the hip. It's a ball and socket joint. In a perfectly developed dog, the rounded head of the femur fits deeply and snugly into the pelvic socket.
Like a perfectly machined ball bearing.
Exactly. They glide smoothly against each other because the fit is exact.
But with dysplasia, that precise engineering goes wrong during the puppy's rapid growth phase.
Yes. The ball and the socket don't grow at the exact same proportional rate, or sometimes the supporting ligaments are just too loose.
And that slight mismatch in growth creates laxity or looseness in the joint.
Right. The ball isn't seated tightly in the socket anymore.
So every single time the dog takes a step, instead of a smooth glide, you get this like a microscopic rattle or clunk.
Yes, the bones are subtly impacting each other over and over.
Ouch. And over months and years, that constant friction just wears away the protective cartilage.
It creates a lot of inflammation, bone spurs, and eventually severe osteoarthritis.
And I assume elbow dysplasia operates on the exact same mechanical principle.
It does. It's the same principle of a mismatched fit, just affecting the complex hinge joint of the front leg instead of the hip.
Now, obviously, you aren't going to have a flashing neon sign on the dog's hip that says cartilage degrading.
Unfortunately not. That would make things much easier.
Right. So the umbrella you need to carry here is behavioral observation.
Which requires paying close attention to daily habits.
Exactly. You're watching for a dog that hesitates before jumping into the back of your SUV.
Or dog that suddenly doesn't want to use the stairs.
Yeah, or you're looking for stiffness when they first stand up after a long nap on a hard floor.
Right.
Or you might see that classic bunny hop when they run.
And a bunny hop, yeah.
Where they kick both back legs forward at the exact same time, right? Because extending them individually just pulls too painfully on those loose hip joints.
Exactly. You're looking for persistent, chronic changes.
Because dogs can just get sore normally.
Oh, sure. A dog that plays hard at the park and is a little sore the next day is totally normal.
Right.
But a dog that consistently struggles to rise every single morning for 2 weeks, that is showing you a mechanical failure.
Okay, alongside the hips and elbows, there's another orthopedic failure point that really blindsides a lot of owners.
The knee.
Yeah. Cranial Cruciate Ligament disease, or CCL.
Very common, very misunderstood.
Right, because this is the canine equivalent of a human ACL, the ligament that stabilizes the knee.
Yes, but it acts very differently in dogs.
Well, yeah, because humans usually blow their ACL in one dramatic moment, right? Like a football player planting their foot and twisting, and the ligament snaps.
Right, it's an acute trauma in humans.
But in large dogs, the source material notes this is actually a progressive disease.
It is a completely different mechanism of injury. In large breeds, the ligament undergoes chronic degeneration. It's structural fatigue.
Okay, so think of the CCL in a Rottweiler not as a single solid cable snapping all at once, but like a thick rope bridge.
I like this visualization.
Right, so if you drive a heavy truck over that rope bridge every single day, the individual fibers of the rope slowly start to fray and pop.
Exactly. It's deteriorating gradually over time.
Yeah. Then, one day, the dog jumps off the couch, which is a totally normal movement, and the last remaining fiber gives out.
And the owner thinks the jump caused it.
Exactly, but the jump didn't cause the disease. It was just the final straw for a rope bridge that had been fraying for 6 months.
What's fascinating here is that when you look at all these mechanical failures, the hips, the elbows, the fraying knee ligaments, you realize there is an incredibly powerful tool in the owner's arsenal.
Oh, do tell.
Obesity is the single most modifiable factor on this entire list of predispositions.
Wow, because it's pure physics.
Exactly.
Every extra pound of fat is an extra pound of force grinding that loose hip joint or pulling on that fraying knee ligament.
Precisely. Keeping a large breed dog lean isn't just about making them look athletic. It is a daily controllable medical intervention.
You are actively reducing the mechanical load on their joints.
Yes. And the same logic applies to their puppyhood, too.
Oh, right, because people want their big dogs to look huge right away.
Exactly. Owners often want to see their giant breed puppy get as big as possible, as fast as possible.
Yeah, which is a terrible idea.
It really is. Feeding them appropriately to ensure a slow, controlled growth rate prevents those bones from outpacing the soft tissues.
Which drastically lowers the severity of those dysplastic joint mismatches we talked about earlier.
Exactly. It's all connected.
Okay, so joint issues represent the slow, persistent problems.
Right. They creep up on you.
You notice a slight limp, you monitor it, you restrict their diet, you schedule a vet visit for next Tuesday, you have the luxury of time.
Usually, yes.
But this naturally begs the question, what are the conditions that completely remove time from the equation?
The emergencies.
Right. Which breed-specific predispositions require immediate, drop-everything emergency action?
Well, the source material highlights two terrifyingly fast conditions, Osteosarcoma and Gastric Dilatation-Volvulus, which is commonly known as bloat.
Okay, let's look at osteosarcoma first.
This is an aggressive bone cancer that predominantly affects the long bones of the limbs in large and giant breeds.
Let's talk about the biological why here, because I think that's important.
It's crucial for understanding the risk.
Why is a 100-pound dog more likely to develop bone cancer than a 20-pound dog?
It comes back to that massive growth phase.
Right. When a Rottweiler puppy is growing from a tiny furball to 100+ pounds in just over a year, their bone cells are dividing and multiplying at an explosive, staggering rate.
It's biologically chaotic.
Yeah, and whenever cells are dividing that rapidly on a massive scale, there's a statistically higher chance for a biological typo to occur in the DNA.
Exactly. And that typo is the seed of cancer. Yeah, that rapid cellular turnover lays the groundwork, and then years later, usually in middle age, the cancer manifests.
And I imagine the signs are pretty obvious.
The clinical signs are starkly different from the slow stiffness of arthritis, yes.
What do you see?
You'll see a noticeable, firm swelling on the leg, usually near a joint. The dog will exhibit a profound, unresolved lameness.
Like not just a little limp?
No, they often refuse to put any weight on the limb at all because the tumor is actually compromising the structural integrity of the bone from the inside.
Oof, that sounds incredibly painful.
It is.
So the critical takeaway for you as an owner is recognizing the urgency here. If you see persistent, localized swelling and acute pain, you don't rest the dog for a week and hope it goes away.
Absolutely not. Osteosarcoma is incredibly aggressive and highly metastatic.
Meaning it spreads to the lungs quickly, right?
Very quickly. Prompt evaluation is the only way you preserve any medical options at all.
And if we're talking about urgency, nothing eclipses the second condition on that list.
Bloat. No. Bloat is the ultimate nightmare scenario for large breed owners.
Because it can take a perfectly healthy dog and turn into a life-threatening emergency in less than 2 hours.
It's terrifyingly fast.
I really want to dig into the mechanics of bloat because on the surface, it sounds bizarre.
It does sound a bit strange if you don't know the anatomy.
Like, I completely grasp why a massive dog has joint trouble. That's basic gravity.
Right.
But why does the specific shape of a dog's chest make their stomach twist? What does the rib cage have to do with digestion?
Well, it all comes down to internal real estate.
Okay, explain that.
Breeds like Rottweilers, Great Danes, and Dobermans have a very specific architectural profile. They are deep-chested.
Right.
Their rib cage extends far down vertically. Now, imagine the stomach suspended inside that chest cavity by its ligaments.
Okay, visualizing that.
In a dog with a shallow, barrel-shaped chest, the internal organs are packed in somewhat tightly. There isn't much room for movement.
But in a deep-chested dog, there's a massive amount of vertical empty space below the stomach.
Precisely. It creates room to shift. If that stomach fills rapidly with gas or fermenting food, it expands like a balloon.
Oh, I see where this is going.
Yeah, because it's suspended in that deep cavity. That expanded, heavy stomach can suddenly swing like a pendulum.
Wow.
And if it swings far enough, the entire stomach physically flips over on its axis.
That is horrifying.
It is. That's the volvulus part of the condition.
And when it flips, it seals both the entrance and the exit.
Exactly like twisting a balloon.
Right, so the gas can't escape through a burp, and it can't move into the intestines. It's completely trapped.
And worse than that, the twisting violently chokes off the blood supply to the stomach tissue and the spleen.
Which sends the dog into severe systemic shock.
Yes. The tissue actually begins to die inside the body.
Yeah.
That's why time is quite literally tissue in this scenario.
So you have a very narrow window for surgical intervention to untwist the stomach.
Very narrow. Minutes matter.
Which means knowing the red flags is non-negotiable for an owner.
You have to memorize them.
The hallmark sign is unproductive retching. Right?
Yes, that's the big one.
The dog looks and sounds like they're trying to vomit, heaving violently, but absolutely nothing comes up because the exit is sealed off.
It's very distinct from regular vomiting.
Right. And you might see a visibly swollen, tight abdomen that looks like they swallowed a basketball.
Along with extreme distress. They'll be excessively restless, pacing, panting, and completely unable to get comfortable.
And this usually happens right after a large meal.
Often, yes.
Yes.
And if you see this, you don't wait to see how they feel in the morning.
No. You put them in the car and drop to the emergency vet immediately.
Do not hesitate.
Now, the contrast between those conditions is pretty striking. I mean, bloat is violently visible.
Very hard to miss.
Right. And osteosarcoma produces obvious swelling. But the source material also forces us to confront a third category of risk.
The hidden ones.
Exactly. The internal threats that stay completely silent while doing catastrophic damage.
This is where things get really tricky.
Yeah, this brings us to the cardiovascular system, and specifically a condition called Dilated Cardiomyopathy, or DCM.
A very serious issue in large breeds.
And this is terrifying because it hides so well what is actually happening to the heart muscle here.
Well, with DCM, the physical muscle wall of the heart begins to degenerate and thin out.
Okay.
A healthy heart is a tight, muscular, highly efficient pump. But in a dog with DCM, the muscle weakens and stretches.
So it's losing its elasticity.
Yes.
Yeah.
The heart chambers dilate, becoming enlarged and flabby.
So it basically turns from a powerful pump into a thin, floppy balloon.
That's a great visual. And because it's floppy, it can't contract forcefully enough to push oxygenated blood efficiently through the body.
Which means the blood has nowhere to go.
Right. Blood starts to back up, leading to fluid accumulation in the lungs or the abdomen.
But the reason this is a silent threat is due to something called compensatory mechanisms, right?
Exactly. The dogs are incredibly stoic animals.
Yeah, their bodies will work overtime to hide a failing system.
They adapt until they just can't anymore.
Right, so by the time the owner actually notices the symptoms, like the dog getting exhausted after a short walk, or a soft, persistent cough from fluid in the lungs, or even just slightly labored breathing while sleeping, the heart muscle is usually already profoundly damaged.
Unfortunately, yes. You've missed the early window.
Wow.
You're observing the end-stage failure of the pump rather than the initial weakening of the muscle.
Which completely redefines the role of your veterinarian.
It absolutely does.
So what does this all mean? It means we have to stop treating the vet clinic like an auto repair shop where you only go when the bumper falls off.
That is the perfect way to put it.
If you own a large breed, the veterinarian is a mandatory early warning radar system.
They are looking for things you can't possibly see at home.
Right. Listening to the heart with a stethoscope on a scheduled routine basis allows a vet to detect a subtle arrhythmia or a minor heart murmur months or even years before the dog ever coughs at home.
Preventive medicine is the only viable strategy against a silent genetic predisposition like this.
It's the only way to get ahead of it.
And the source material highlights a really great tool for this called the Vital Pet app.
Oh yeah, I saw that. It's essentially a digital logbook for owners.
Exactly. It's designed to track these long-term health metrics, weight fluctuations, scheduled cardiac screenings, joint evaluations.
So keeping that data organized ensures you aren't just reacting to crises, but you're actively monitoring that early warning radar over the dog's lifespan.
It keeps you proactive.
We've covered a tremendous amount of ground here.
We really have. It's a lot of biology.
Yeah, we've looked at the fraying rope bridges in the knees, the anatomical pendulum of the deep chest, and the silent floppy balloon of a weakened heart.
Which, when you say it all together like that, sounds very daunting.
It can feel overwhelming all over again, but how do we actually fight back against the biology?
Well, it starts earlier than you might think.
Right. How do professionals systematically shift these genetic probabilities in the dog's favor?
The true fight starts long before the puppy ever takes its first breath. It relies entirely on the ethics and rigor of responsible breeding.
Because genetics dictate the blueprint?
Exactly.
So a reputable breeder isn't just taking two Rottweilers that look cool and putting them in a yard together.
No, far from it.
So a reputable breeder is essentially acting as a biological risk manager for the future of the breed.
That is exactly what they are doing. They use standardized orthopedic evaluation programs, like the OFA, to X-ray the hips and elbows of the adult dogs.
Before they even think about breeding them.
Right. And they have veterinary cardiologists perform echocardiograms to look for any microscopic evidence of DCM.
Wow, they do all of this data collection before a single breeding decision is made.
Yes. If an adult dog shows evidence of poor joint conformity or an irregular heartbeat, they are removed from the breeding pool.
So they're systematically stacking the genetic deck.
Generation by generation.
Right, you don't breed a dog with loose hips hoping for tight-hipped puppies. By only breeding the dogs with the strongest, tightest joints and the healthiest hearts, breeders actively engineer these predispositions out of the bloodline.
You shrink this statistical risk pool.
That is incredible.
And if we connect this to the bigger picture, it reveals the ultimate formula for thriving with a large breed.
Okay, what is it?
It's essentially a two-part contract. The first part happens before you even meet the dog. Finding a breeder who uses relentless medical screening to give you a puppy with the best possible genetic blueprint.
Right. And the second part?
The second part is entirely on you. Executing diligent weight management, ensuring slow growth, and prioritizing those early warning veterinary checkups.
It's the perfect partnership between the genetic history of the animal and the daily lifestyle you provide for them.
It really is.
So to recap our mission today, we wanted to separate the facts from the fear. And the biggest takeaway, a genetic predisposition is nothing more than a weather forecast.
Exactly. It's a statistical heads up to buy an umbrella, not a guaranteed tragedy.
Right. By understanding the mechanical why behind these conditions, you take the mystery out of them.
Knowledge is power here.
It is. You know, to watch out for the violent, unproductive heaving of bloat, to monitor for the persistent limp of joint wear, to keep them lean, to protect their ligaments, and, to let your vet's stethoscope do the silent work of monitoring their heart.
And if you commit to that proactive management, you can give a massive, powerful dog a remarkably long, comfortable life.
Moving from anxiety to empowerment changes the entire ownership experience.
It completely shifts your mindset.
Yeah.
But, examining all of this biology leaves us with a highly provocative question to consider.
Oh, lay it on us.
Well, we've established that aggressive screening and careful breeding can drastically lower the incidence of these diseases, right?
Right.
But if veterinary science continues to map these predispositions down to the individual gene, will we eventually reach a tipping point where we can breed these risks out entirely? Or, and this is the flip side, does the fundamental physics of maintaining a 100-pound, deep-chested, heavily muscled animal mean that a certain level of mechanical and internal vulnerability is simply the unchangeable price of admission?
That is heavy.
Can you truly separate the giant dog from the giant risks?
That is a phenomenal biological puzzle to leave you with. The eternal tug-of-war between precise genetics and inescapable physics.
That's something to chew on.
Definitely. Well, thank you for joining us on this deep dive. Keep questioning the things you read, keep exploring the science, and remember that informed proactive care is the best medicine in the world.
Absolutely.
As always, a quick reminder that while we love exploring the mechanics of canine health, this discussion is strictly educational. If you ever notice concerning signs in your own dog, your real-world, qualified veterinarian should always be your first call. We'll catch you on the next deep dive.